Hi everyone, my name is Andrea and I'm a psychological well-being practitioner here at the private therapy clinic. Today I'm going to talk about mindfulness, specifically what it is, its benefits, its use in clinical practice, and we're going to finish off with the short and simple introductory practice to mindfulness meditation. To start off and to give credit where credit is due, although a relatively new approach to Western psychology, mindfulness meditation is in fact a 2,500-year-old Buddhist practice. According to Buddhist thought, we individuals have a tendency of not being completely present, and that not only alters our perception of reality, but it also minimizes our capacity to consciously take part in the present moment. To put it in simple words, we tend to get stuck in the past. For example, thinking about past actions or choices we have made, doubting those choices, wishing we would have chosen differently. But at the same time, we also get stuck in a future that hasn't even happened, thinking about what's coming next, stressing about the next steps. This can lead to us missing out on our experience of life whilst it's actually happening. Quickly going back to the origins of mindfulness practice, in Buddhist teachings, those who do not practice mindfulness are often associated with a walking corpse, one that navigates through life in an almost automatic mode, never really stopping to breathe in and out or be present and alive in the here and now. Does that sound familiar? Think about your day-to-day life. How often do you go through the day without actually being fully present? Have you ever had lunch in front of the TV and all of a sudden you realise you finished your lunch and you don't even feel full, you feel like you barely even tasted the food? Or for example, if you drive, how many times have you driven from home to work and suddenly there's a moment you don't quite remember a big chunk of the journey you just did, even though you were the one driving? This is what it means to not be present, to be away from the present moment. In clinical practice, mindfulness refers to the innate state in which people experience the present moment and are aware of it without being overwhelmed by what's going on around us. To quote John Kabat-Zinn, mindfulness is about being fully awake in our lives. It's about perceiving the exquisite vividness in each moment. It's a deep engagement with the present moment and the appreciation of life. And I want to quickly highlight one sentence from John Kabat-Zinn's quote, being fully awake in our own lives. What does that even mean? When we live our lives in a mindful way, we're able to take a moment to just step out of our current state and observe our feelings, thoughts, emotions, behaviours. Mindfulness meditation enables us to regain control of those emotions that usually drag us away from the present moment, like anger, stress, frustration, worry. Mindfulness teaches us to live in the present moment. That doesn't mean that we don't care about the past or the future, but mindfulness allows us to be open and accepting of whatever the reality is in our lives. It teaches us forgiveness, patience, self-awareness, self-love. It teaches us to reconnect with ourselves. But why does mindfulness work, and how do we use it in clinical practice? In the last 2 decades, mindfulness practice has been extensively researched and studied by scientific researchers and health practitioners. One of the latest big discoveries in neuroscience is something called neuroplasticity. Neuroplasticity is essentially the idea that the structure and function of our brains can be shaped and modified by our experiences in life. One of the first randomized controlled trials that tested the efficacy of mindfulness meditation was done on 37 psoriasis patients who were undergoing ultraviolet phototherapy or photochemotherapy. To treat the condition, the patients were randomly assigned to one of 2 conditions. The first one, a mindfulness-based stress reduction intervention, which consisted in guided audio tape instructions that patients practiced during the light therapy. The second condition, or the control condition, consisted in the light treatment alone, with no mindfulness meditation involved. At the end of the study, researchers found that the group that practiced guided meditation during the light treatment were significantly more successful in seeing a decrease in symptoms of psoriasis. The study found that meditators' skin cleared about 4 times faster than the non-meditators. Another example, there was a study that explored changes in brain function and immune function after practicing mindfulness meditation. The participants were employees at a high-tech corporation who underwent significant amounts of stress in the workplace. The participants were randomized again into two conditions. The first one, an 8-week mindfulness stress reduction program. The second one, a waiting list in which they did not receive any type of intervention. At the end of the 8-week mindfulness program, the two control groups were vaccinated with the influenza vaccine, and the findings were astonishing. The researchers found that an 8-week mindfulness program produced positive changes in brain function and also boosted immune function. The participants that practiced mindfulness showed a more rapid rise in antibodies after the flu shot compared to the control group. Of course, these are only a few examples of the research that has been done surrounding mindfulness, but thanks to the past few decades of extensive research, mindfulness was introduced to clinical practice, and even today, mindfulness is currently recommended by the National Institute for Health and Care Excellence as a preventative measure for depression. The treatment is mainly recommended for people who have had 3 or more episodes of depression in the past. The extensive body of research and growing popularity of mindfulness has resulted in the development of standardized mindfulness-based interventions, which combine modern psychological practices with the nature of traditional mindfulness. The two main therapy models that incorporate mindfulness practices are mindfulness-based stress reduction and mindfulness-based cognitive therapy. Mindfulness-based stress reduction is an 8-week program that combines elements of mindfulness meditation, stress management, body scanning and yoga practice, which help cultivate mindful ways of dealing with the stress of everyday life. Through learning and developing the skill of mindfulness, participants learn to decrease their emotional reactivity, which often results in a deeper sense of calm overall. Research has shown that this type of intervention, in combination with other types of interventions, can be effective in reducing symptoms associated with anxiety, depression, IBS, heart disease, sleep difficulties, chronic pain disorders, and even addiction. On the other hand, mindfulness-based cognitive therapy combines elements of cognitive behaviour therapy, CBT, such as learning basic psychoeducation about how thoughts, attitudes and beliefs can affect feelings and behaviours, and teaches people useful coping strategies for dealing with unhelpful thought patterns. Research shows that this type of intervention can be effective in helping people manage the symptoms associated with recurrent depression, bipolar disorder, eating disorders, chronic pain disorders, epilepsy and even psychosis. In conclusion, mindfulness has been proven to be effective, especially when combining it with other interventions. However, mindfulness isn't only a practice. Mindfulness is a skill, it's a lifestyle. So for sure, it might take some time and practice to get the hang of it and notice some improvements. But this is not a journey you should have to do by yourself. Mindfulness is currently available and used by many mental health practitioners. So if you're interested in mindfulness, you can always contact the private therapy clinic and book a 15-minute call with us. This would give you the opportunity to speak with a psychological practitioner about your needs and goals in therapy, and we'll be able to refer you to the most suitable practitioner for your case. Thank you all for listening.